Hello and welcome back to my YouTube channel. Today I'm going to be explaining two major medications that people keep taking and they are not supposed to take them. Medications you are not supposed to take if you are planning to get pregnant. If you're a woman trying to get pregnant, or if you are pregnant as a woman, and even when you are breastfeeding a baby as a woman, you must avoid this medication. The first medication I will be explaining in this video is what we call tetracycline. Tetracycline is an antibacterial medication that most people take when they are having diarrhea. But that is very wrong because tetracycline is not an anti-diarrhea. Rather, it is an antibacterial medication that can kill any bacterial infection in your system. So if you're that kind of person that will be abusing tetracycline, you should stop taking tetracycline as a woman who is trying to get pregnant today. Because when you take it, it can delay your ovulation as a woman. Not just that, when you are pregnant and you take this medication, it can cross into your baby's system and affect your baby's heart, your baby's kidney, your baby's brain, your baby's blood, and even cause problem to your baby's tooth, making you to give birth to a baby that has a different color of tooth instead of white. Your baby will be having either yellow tooth, discolored tooth, and that's what tetracycline can do. So if you are a pregnant woman or you're a woman that is trying to get pregnant or you are breastfeeding a baby, you should not take tetracycline. This is not the right medication to take when you are pregnant. There are other medications you can substitute in this regard. Now, the second medication is ciprofloxacin. Now, this is one of the major medications they prescribe to women when they are having typhoid or they're having other bacterial infections. But this medication is not meant to be taken if you are trying to get pregnant, if you are pregnant, or when you are breastfeeding a baby. Now, this is what ciprofloxacin can cause. It can cause problems to your baby's heart, your baby's kidney, your baby's joint, your baby's muscle, your baby's brain, and even you as a woman, you might undergo miscarriage, making you to lose your pregnancy. So if you are trying to get pregnant, you shouldn't use this medication because it can make you not to get pregnant, or it can even make you to lose your pregnancy at early stage. And even it can affect your baby when your baby is growing in your womb. And when your baby finally comes out of your womb, it can also affect the development of your baby. And that's why you shouldn't take this medication if you are breastfeeding your baby as a woman. I hope this information helps. If you find it very helpful, please do it to share it to as many people as you can. And don't also forget to drop your questions on the comment section so I'll be there to respond to them as soon as possible. I'll see you next time. Hello and welcome back to my YouTube channel. Today I'm going to be discussing a very important topic, a very interesting topic, medications you need throughout your pregnancy. Medications you need to be taking when you are pregnant. And the first medication I'm going to be explaining, because I'll be going directly into the point I have here. I'm not just going to be beating around the bush. I'm going to be going directly into the medications you're going to be needing when you are pregnant. The first medication that most of us know is folic acid. Now, folic acid is to be taken 3 months before you get pregnant and 3 months into your pregnancy. That means after 3 months of a pregnancy, you don't need folic acid any longer, because folic acid is very important in formation of a baby. So after 3 months, what are you taking it for? Because within the first 3 months of your pregnancy, that's when the baby's organ is being formed. We call it the first trimester. So you need to take folic acid at this stage of pregnancy so that the health of your baby's organ will be formed in the right way they are supposed to be formed. And that's why you will need folic acid. But after then, you don't need folic acid again. The only people who should take folic acid throughout their pregnancy are people who are SS genotype. People who have SS genotype, these are the people who should take folic acid throughout their pregnancy. And people who also have certain blood disorders. If you have a blood disorder, you might at least be having shortage of blood because your blood might be breaking down. You might be having anemia, and because of this, you might need folic acid, because folic acid also helps in the formation of blood. So when you are not having any of these conditions, then you don't need folic acid again. Rather, there are other medications. There are so many other medications you will need to be taking as a woman. In case you're that kind of person that have been wondering what you should take if you are pregnant or after 3 months of pregnancy. The first medication you are supposed to take throughout your pregnancy, the medication you should take that will help you and your baby to have a healthy pregnancy and to have a healthy delivery of your baby, includes one, omega-3 fatty acid. This omega-3 fatty acid, most of you don't take it because you don't know the importance and you don't even know what it can do to your baby and what it can do to you yourself. The importance of it to your baby and the importance of it to yourself. That's why most of you don't take it, but it's very important in the formation and the development of your baby's organ and even you yourself to maintain a healthy pregnancy. What omega-3 fatty acid does is it helps your baby's brain to be formed in the right way, and it also helps your baby's eye. So you will not give birth to a baby that is having a low IQ. You will not give birth to a baby that has eye problem. And as a woman, you also have a healthy pregnancy, and you might also deliver your baby the way you're supposed to deliver your baby without so much stress because you have taken omega-3 fatty acid. The second medication you will need throughout your pregnancy is calcium. Most people undermine the impact of calcium in baby. Now, calcium can help in the healthy development of your baby's bone and your baby's teeth. The other medication you will need is vitamin D. This vitamin D will help this calcium to make your baby's bone to be strong and your baby's teeth to be strong. So as a woman, in case you have not been taking these medications, you will need to start taking them from today because they can do more than what you think. And some of us neglect all of this. The last medication I'm going to be explaining for you in this video is what we call Fasolate, that red one. That medication is very important in the formation of blood. It also helps your baby's organ to be formed the way they're supposed to be formed. And it can also help you as a woman to maintain a healthy pregnancy even till delivery. When you want to deliver your baby, you might not experience complications because you are taking these medications I've just explained. So after watching this video, if you enjoy it, please do well to subscribe to my YouTube channel so you can get more amazing videos like this. And if you also have questions you want to ask about this particular topic or about your health, please do well to drop it on the comment section so I'll be there to answer your questions right away. And if you also have topics you want me to talk about, please do well to drop them on the comment section so I can be here to respond to them. Also, don't forget to share this video to as many pregnant women as you can, and you might be saving the life of someone. Thank you for watching this video. I'll see you next time.